Hi, my name is Greg Felt. I'm Director of Public Health for Sheffield. This is a short piece to video on where we are. All of the signs are that the number of people being diagnosed with COVID is actually quite low now. The incidence has come right down. The number of people who are admitted to hospital is vanishingly small, and the number of people who sadly die is almost zero every day by day. So all of the signs are that wave one is coming to an end. That's fantastic. So we've shifted from a place where there was very widespread community transmission across the city to much more isolated outbreaks and a much lower level of transmission. There is, however, transmission across the whole of the city. It isn't isolated to small parts of the city. It is across the whole of the city, admittedly, at much lower levels. So we're trying to get to a place where we can be confident we can reopen Sheffield. We can't live in lockdown forever, and we need to reopen Sheffield and reopen Sheffield safely. We have in place a mechanism to respond to outbreaks as and when they happen, and we have in place mechanisms to track and trace or contact trace people who do test positive with COVID-19. This is the NHS track and trace service. It's working in Sheffield. It's working pretty well, actually. Not perfectly, and it's improving week by week. However, it only works if we all accept it and we take the recommendations that are given to us by track and trace. If we all ignore it, then it won't work, and we'll have much higher rates of transmission. Then looking into the medium term, you would think that this is all over. It's not. This disease is growing across the world. Whilst the rates are coming down in the UK, not fast enough, it hasn't gone away. There are parts of the world that are nowhere near their first peak yet. So if people hear the message, it's all fine now, it's all gone away, and start to behave as we were 7, 8, 9 months ago, there's no doubt we'll see an increase in cases. As we take off the lockdown, we will undoubtedly see an increase in cases because more people will mix and there's more opportunity for viral transmission. So, it's important that we continue to take this seriously. We've all seen what happened on Bournemouth Beach last week. I would guess that will lead to an increase in cases. So, we don't want that to happen. It's impossible to underestimate the seriousness of the situation. This issue hasn't gone away. As I say, we can't live in lockdown forever. But the lockdown did save lives. There's no doubt about that. But what it did was buy us time to protect our health system and by doing that to save lives. But it didn't change the fundamentals of the virus, how infectious the virus is, or the clinical illness that virus causes. So we're in this for the long haul, no doubts there. I would be surprised and delighted if we weren't in this current situation through the winter and into next spring. I would expect there to be considerable COVID-19 circulating in that time. I think it's unrealistic for science to come up with an answer within that time. In the medium term, I'm more optimistic. There will be a vaccine eventually. It remains to be seen when that will happen and how effective that vaccine will happen. But history tells us that science will help us in this space. So we'll pin our hopes there. But for the meantime, in the short and medium term, certainly, we should be planning for the long haul for COVID to continue well into 2021. So we're going to have to learn to live with that virus for a long time. It will be with us for a long time. Whilst the rate is coming down in the UK, it's coming down slowly, and that can and will change as we water down the measures to control the lockdown, and we understandably open up the city, and we need to take great care there.